let's continue to that panel debate, and as I see it, you have a chance here to continue asking questions and comment also on the panel debate. It's always a challenge when you're online, since it's good for me as a moderator because I can decide who talks and nobody can interrupt each other. But let me turn to Barbro Westerholm, and I'm so happy that you're on board, Barbro. And you are really qualified. You are a medical doctor and you are a researcher. You are also a civil servant, a former civil servant. You have been and you are a member of parliament for many years. And you're also an expert when it comes to healthcare and elderly care. Now, we have heard a lot of different aspects on innovation, but I would say that the aim is always to improve elderly care, and innovation can be a part of that. And especially looking at the COVID situation now, for example, what are your reflections, Barbro, in order to improve and help elderly care to get better? Welcome.
Thank you. Well, my reflections, I think COVID-19, despite all the deaths and all the bad things happening, it has put focus on older people. And it's so obvious that society before saw older people as a collective, not as individuals. And I can see from the papers you have given today that there is a change, a positive change, that older people are individuals and they become more and more different as the longer they live. And therefore we have to have a society which meets the different demands from this generation. And this generation should not be age discriminated, as it has been for thousands of years, actually. But now we have to give their quality of life to everyone. And the first paper dealt with privatization, and I think it has come to stay. And in the investigation I'm leading on home care for older people, we see no difference. Maybe a slight better quality in private situations, but the indicators are not that good. And you have also put that forward, that we need better indicators in order to measure quality of life for older people in care homes and in their own homes, but also quality of life for staff, because I think we have to shape a good environment for both of them. And then I think this with meeting needs. I think in the Netherlands, you had a catastrophe a couple of years ago, obviously, which we have in a way met in Sweden during the COVID-19 here. And we should really learn from what is happening in the Netherlands now, providing facilities for old people with their individual needs and wishes, that you have this village. Some Swedes say, no, not a segregated village for demented people. But ask the ones who live there, do they like it or not? I mean, we who are healthy and are not in their situation, we believe a number of things. We have myths about their situation and how their life is being led and lived, which isn't true. Ask people. And I think we have to learn from the Netherlands in Sweden to develop a society with a variety of options for demented people in order to a life that make them feel, I'm curious about what is going to happen tomorrow. I think that is important for every old person living in their homes or in care homes, that they should be curious what is going to happen tomorrow, what is in it for me, and not just to say in their prayers, please God, don't let me wake up tomorrow. This is a sentence which I have met too often in care homes, that there is nothing to live with. And this has also been true in this period of isolation due to COVID-19. Then Karin, Thalén put up this collaboration, and also Peter with the Norrtälje organization, that we have to collaborate, not work in silos. And in Sweden, we really have to learn from what was said by Karin about Stockholms Sjukhem and from Norrtälje, what you can really, I mean, it will be better for the patients, the older people, it's better for the staff, and it's much better for the economy also, if you link care for older people in their homes with primary health care, with the hospital care, and so on. And I wonder really why there are such obstacles against the introduction of this way of organizing care in Sweden. Peter, you might have the answer. And then this with technology. I think Henrik said in the beginning that technology, no, that was not really a solution. I think it's not a solution, but it's one among many solutions. I think that Catharina spelled it out so well about your mother. Ask, what do you need to be able to live an independent life? I mean, I would rather have a robot in the loo in my home than someone I don't know that much about helping me there, to make me independent in these very, very personal activities which I need. So I think technology has a future, but it has to be made simple. I've been involved in some projects testing various equipments, and some have been so complicated to use that the users, the older people, put them in their wardrobes, and that listen to what people need, listen what they ask for to be able to use them. So in order to live an independent life. And then figures were shown about the increasing number of older people and the increasing needs. I would very much like a seminar then about how can we make it possible for people to live an independent life as long as possible. Should we prevent falls? How should we prevent a number of things which can handicap older people in order to help them without technology, hopefully, to live an independent life? And I shouldn't use up too much of your time. This was just a kickoff for the debate. Thank you.
Barbro, you are really a star. Such good reflections. Thank you so much. And really talking about being an individual, how important that is. And I noticed that on my mother too. And I was so sad looking at all different things that could have helped her. And I really liked the way you put it, to be curious about tomorrow. So I have also met many people at elderly care homes. They are not curious. They don't have the spirit. So let us all try to work for that. I have one question directly for you, Barbro. And that is, we notice that it is a rapid development of innovation in healthcare. Also on the technology side, why is it so slow when it comes to elderly care?
I think it's age discrimination. Older people are not prioritized in research, in care. Much of it is hidden. People are not aware. It's a lack of awareness of the needs of older people. And I think now when healthcare, hospital care is moving into people's homes, in their flats and so on, I think maybe the interest in developing other technology will increase. And here I think COVID-19 is now helping us to put priorities to these areas.
Thank you, Barbro. Henk, you have been listening also to Barbro's reflections. I don't know if Magnus, if you have a question for Henk, but so far, do you have also some reflections on the discussion?
Yeah, I think one of the big issues is implementation. We have developed a lot of good knowledge and a lot of tools and instruments, etc. And there's so much on the shelf, and we are not using it. And one of the, I saw it in Karin's presentation as well, the COVID-19 crisis gave a huge impact in using technology. But what I see now is that there's a fall back to our old traditions, I would almost say, of going back to the traditional way of working in healthcare and long-term care, etc. But how can we implement? In our country, in the Netherlands, my organization Vilans is now working with organizations in the disability sector in order to learn from each other how to implement technology through their entire organization. So learning from each other is the strategy that we are following, and then learning from peers is the strategy. And so that's one of my puzzles, is why aren't we implementing? I was in Japan last year to look at technology. We got great demonstrations, and then we came in regular nursing homes, and they were working with paper documents, and they did not use the technology. And I was asking, why don't you use it? Well, we don't have the money for it. So I thought, well, but they did have money to use the staff, which could be saved by technology. So there's something strange in the way of we are funding organizations, we are funding home care, etc. So when we are looking at implementation and scaling up, we need to look at skills and capabilities of staff, but also to reinforcements from our systems that we have, our funding systems, etc. And maybe that would be the biggest innovation that we need, is how to implement instead of finding more devices, and that will go on. But if when we really learn the lessons of how can we implement on a large scale, that would contribute. And many things that are mattering to people are not that difficult. There's a lot of technology that you can buy in the stores, in the streets, on internet. That's not sophisticated, but you need to know how you can use it. And that's, I think that would be one of the major concerns for the next time. And it won't be the solution for everything, but it will help a bit. And I think we need to work on various scenarios, various strategies that help a bit in order to deal with the challenges of the future. And reflecting on Barbro, I showed the green farms, and one of the nice things is that people have the feeling there's a reason for me to get up, because I have to go to the farm and take care of the animals. And that's much better than just to play bingo, which is also very nice. I agree with that as well, because you meet other people. But I have to go to the green farm to take care of the animals is a reason to get up in the morning. And we think we should find much more meaningful activities and help to find more meaningful activities. And helping people to live a normal life has become extremely complicated in our healthcare system. We have invented everything which is not normal. And it would help people very much to live a normal life and find something to get up early in the morning. So that's, well, a point that I would like to make. Thank you.
Okay, thank you so much, Henk. Magnus, do we have any comments, questions?
First of all, I have to comment on the last one. I need that for my kids now in November in Sweden to get up in the morning. That's a hard thing, even if you're a young kid. But let's go to the questions. We should move towards an ecosystem of care. Is it a future model of care in highly developed countries with a population with high educational level? And as a complement to that question, will that lead to unequal elderly care, even though the system seems very good? Yeah, it's directed toward you, Henk.
Oh yeah, okay, yeah. I hope it will lead to unequal care, not in the sense that it is not the same solution for everyone, but everyone should have equal access to care. So that is. So I hope there will be diversity, and that we find diverse solutions because people are different. Everyone is a deviation from the average, and I think we should and we should not provide average care, but we should give people support which is very tailored. And I think it's I think the development towards ecosystem has a lot to do with being higher educated, being better able to find solutions. There's many patients, clients who are much more or better informed about their disease and about their disability than their doctors are, for instance. And it's not all, and I know there's many who are not, but some of them are, and you can be very well informed. These citizens' initiatives that I talked about, many of these people are highly educated people who can find the solutions, and they connect to people with other skills, who can do transportation, who can do voluntary work, etc., voluntary work. So I think that it is indeed a level of being more educated as a population to find these solutions. And the time that was paternalistic, we had much lower levels of education. So I think we are moving into that direction, unless the dictators will win the battle, but hopefully not.
Hopefully not. I was about to say, let's see tonight. But
this was not a political statement.
Exactly. I'm sorry. The next question is for all of you. Healthcare costs have continued to outpace inflation and just about everything else with the economy. Generally speaking, prices rise when demand increases relative to supply. How could we address this in concrete measures? Just a small question. Whoever likes to take that on.
Well, I think they should start reading Forum for Health Policy's latest report about healthcare after Corona. It will be published in English very soon. But of course, I'm not going to answer that question. Who is ready? Who wants to? Peter?
Yeah, it's an excellent question, actually. The question in one way, I think, summarizes what we're talking about. And regarding these elderly patients, frail elderly, if you wish, or I say complex patients, because it's complex people. I mean, it's many different. I think Karin Thalén showed the one with the picture with it. So we have to realize that if you have complex problems, you can. I was head of the Astrid Lindgren Children's Hospital. They were young, those kids, but they had also complex issues. And we have to treat those patients differently than we do ordinary if we have emergency with heart infarct or something. The complex patients, which we're talking about here, they have to be treated differently. And all the complex patients, I think we all agree on that, have different needs, different issues. The Alaska, I'm a big fan of the Alaska Douglas Eby, the NUCA system in Alaska, and they have a very nice approach of how they look at their system. It's a consumer-owned system in Alaska and consumer-driven. They do everything that the consumer, the public, the owner of the system, what they want. And they have, after 25 years now, they can show excellent results, much lower costs, better medical outcomes. People are happier, the staffs are happier, etc., etc. So I think there are evidence that if you go about it this way, it's better for everybody. Karin, Thalén, and myself, Norrtälje and Stockholms Sjukhem, we are half the way to the nuclear system in Alaska. We understand, but we're not there. At least I'm not there, and I can see that there are many obstacles in the integrated system where we do the wrong things. For instance, we have now an excellent mobile team from the hospital, Norrtälje Hospital, during the corona crisis, because the frail elderly, we don't want them to come to the hospital. They don't want to come to the hospital either. So we treat them at their homes. It's much, much cheaper. One nurse and one doctor, a little team and a rehab person. They have 20 patients that would, not all of them, but at least some, maybe half of them would otherwise go to the emergency and come into the hospital. They stay at home and they are much better there. And they sort of, our beds, our hospital's bed are gone down because the staff, they are home sick now. So without that mobile team, I don't know how we would survive during the corona crisis. When it comes to the reimbursement system, we don't even know how to measure it because it's not outside the DRG system and things like that we argue about how could we show that the mobile team is of any impact at all. I mean, and this is the problem. In our elderly homes, we know perfectly well if we put in a floor, the floor goes like this. It's a quite cheap invention from the KTH, Kungliga Tekniska Högskolan. You can put in a floor like that, and if you fall down, you don't break your hips that much. So it's an excellent solution for the elderly in the elderly homes. Who wants to pay for it? The municipality says we don't have the money, and if you fall and break your hip, the other side gets the benefit. So we do these stupid things all over the place. And Barbro's question, why isn't it implemented? Because we have the silos with the municipalities in Sweden, and we have the regions, healthcare, and different budgets and things like that. So this is for the scientists, Henk and people like that, to figure out how do we make a reimbursement system that sort of does the right things. We haven't talked so much about prevention. Prevention is almost for free. No one pays for it. No one really drives it. I think we should do these things so that the patient won't get sick and go into the hospital and cost a lot of money. So this is sort of the $10 billion question. How do we do this? Thank you.
Okay, thank you, Peter. I don't know if you, perhaps you have more questions, Magnus, or?
Yeah, or if anybody else wants to take on that big $10,000.
Yeah, perhaps.
I heard your story and I read the presentation of Karin, etc. And the problem is similar in our country and in a lot of countries. So we think system reforms may change it. They won't change it. In whatever system you have silos. So I don't believe in a world without silos, but the point is, can we make innovations in our funding system so that we get the right money to the right people? So maybe a next seminar should be about innovations in funding, because that gives all wrong types of behavior. And that's one of the things which is bothering me. And the second point is maybe we are too rich. We can still afford to act in a way in which we are spoiling money and resources and people. And what we saw in this Corona period, COVID period, we saw that lack of staff, etc., and lack of options gave an enormous impetus to using more innovations. And now we are falling back to the time that we have less pressure on the system. So sometimes I think having too much money doesn't make us aware of how we can improve. We are complaining about budget cuts, but that's only slowing down the curve, the Baumol curve, so to speak. But it's not really a budget cut in our country, and also not in other countries. So, being a sort of a provocative, I would say maybe we're too rich to really innovate.
Karin, are we too rich to innovate? We may be too rich to innovate.
Peter, you talked about preventions. I think we can use volunteers much more in healthcare and elderly care in Sweden than we do, because we aren't paid for preventions from the region or municipalities. And Peter, earlier you asked, how can we do it better when we started today? And I have two comments. I think we need concepts for how we organize and deliver a seamless healthcare and elderly care. And therefore, the politicians must show courage in decision making. I think it's very important. And the second thing is start with our managers and staffs. Make it exciting to work in healthcare and elderly care, because you must have both managers and staffs who wants to work in healthcare and elderly care with energy, desire, and joy. Make it fun. So now, yes, start with the managers and staffs.
So Karin, is that a comment to politicians, or who should do that? Isn't that a responsibility for everybody?
We must do as providers of healthcare, absolutely. Both politicians and who run healthcare must make it more exciting to be in healthcare and elderly care.
Can I comment on that,
Peter?
Yes, this is very, very good, Karin, and it's very, very important, I think. During the early phase this spring of the Corona crisis, we have never worked so hard in the region. The staff, they worked, every weekend in the beginning. I worked every weekend in the first 10 weeks or so before we got everything running. So, and the ICU units tripled their capacity, things like very quickly. But the staff has never been so, engaged, and the doctors and the nurses and the leaders, they stepped forward and they really, really, really wanted to solve the problems. And we see that the applications to the nursing school have risen by 30%. Why is that? The politicians, in Sweden at least, and in Stockholm, this early when the Corona started, they stepped back and said, "Hey, you have to do this." So the professionals came forward, and it was really amazing. We worked really hard, but everyone felt now we're doing the right things. The mobile team I was talking about, they are so proud with the mobile team, because they see when we come out to the dementia patients out in the islands, outside the archipelago, we really do the right stuff, and we can prevent with small help, anxiety, things like that. Addressing the right issue, we prevent them from coming into the emergency very often they go in, they go back, they go in, they go back without any. So it's really to let the professionals or the leaders, as Karin said, it's really important for them to sort of manage in the right way.
Thank you, Peter. Barbro, you are a politician, so now
Yes.
you speak for all politicians.
Yeah, and then it depends on which level you are. I'm a member of parliament, so what I can do is to see how we can put state tax money into the right boxes. And here I think the possibility for healthcare personnel to move on. I mean, if you have very young people who start at the bottom of the old elderly care, and to be assistant nurses, and from being an assistant nurse to be a nurse, and then from being a nurse to be a specialized nurse, and to get that education with pay from the regions and the municipalities with support of state money. I think that is one of the ways to do it. And especially now when we have many people who lost their jobs and went to the care of older people during the COVID-19 pandemic, and then realized that this is a kind of job I want to go on with. So I want to be an assistant nurse and so on. And there we politicians should really then make it possible here with, it's money actually, if you are at this level, then it has to be organized at the regional and municipality level. And then of course, to make people and also journalists sometimes to write the positive things to work with older people. Very often it's the backside of it, the catastrophes and the spread of COVID-19 in homes for older people's care. But also what Peter just said, that it was a challenge to solve these difficult problems. I saw the same things when my governmental agency, the National Board of Health and Welfare, should have a cut by 1/3 of the staff, and the 2/3 had to cope with all what was being done. And when I asked them, when did you really thrive best in this governmental agency? And it was really when we worked 24 hours a day in order to solve the problem. And then we had a party afterwards. We celebrated. And I think that is very important, that once you have managed to solve the difficult problems, have fun with all the stuff. And it doesn't have to be very expensive. You can do very much on your own. What we did was to have a competition in cake baking.
Okay, thank you so much, Barbro. So let me turn to Andrew. Now we're talking about demands for innovation. We need it. We have challenges, we have problems, so we need innovations to actually to answer to fulfill those needs, right? And you gave us lots of examples of different technical stuff. So I was just wondering, also with a connection to that, I think it's much slower development in elderly care when it comes to technological development, even though we have a demand. Barbro was talking about age discrimination. Peter and Henk were talking about funding and so on. What is your view or comment on to speed up innovation in a person-centered way?
So I've been listening to the conversation and looking for the link to innovation. A lot of the conversation, I think, was actually about systemic innovation. if we want to change the way that the funding works and who benefits and who pays and so forth, these are evolved systems, and it doesn't matter how we change them, somebody will lose. And then this will lead to resistance due to this fact. If we introduce technology into the mix, I think that our experience with the internet and everything else has just shown that technology is not a panacea. It does not solve all of our problems. Rather, it accelerates some processes and perhaps slows down others or distracts from them. And this can cause problems. I think that what we need for the innovation, if I go back to a classical role designation, you have the researchers, the engineers, and then you have society at large. Engineers can only solve the problems which have been well posed. Scientists research mostly on what they want to or what they get funded for, which is perhaps not that which is demanded by the society. I think there needs to be a good interaction between the various groups, researching, engineering, and society, in order to properly define what is the problem. We see problems with aging. Age discrimination, for instance, is definitely a problem, but I don't know that we can solve it with technology. It's more of a societal issue. We can provide singular solutions out of the innovation, and then perhaps what we can do is we can look out for possibilities where if we solve a single issue with a technological point of view, this will set free energy to allow other forces to take charge to help things. For instance, Barbro was talking there about how long it takes to become a trained nurse and these sorts of things, how long it takes to do this training and so forth. One technology which you see in industry which is being used is augmented reality, where you get sort of a description. How do you do something? It's just step by step, step by step. I mean, I've seen back in my days when I was in industry, we had demonstrations out of India where you put on one of these augmented reality glasses, you look at an engine, it recognizes the parts and says, turn this screw, replace this part, tuck, 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 step for step. And I think in order to really reduce costs, increase efficiency, if we may take this approach to how we do the care, not in terms of mechanizing things, but in thinking through how it is we want to do things, then perhaps we can use these technologies to speed the rate at which people can be trained, speed the rate at which people can get in there, and also you have a leverage. I think a big difference between my generation and my children's generation is they live in a world where if they want to find out something, they just go to YouTube. And they get it something, and you find everything in YouTube. If it's caring for a baby to breaking into a house, you can find anything in there. And if we can take this in a perhaps more focused way, we say what are the societal problems we need to solve, where we have the highest costs, and where we need to change the skills. We take an approach to using technology to enable people to have those skills. And perhaps we can make a larger difference than if we try and investigate the next fall sensor or the next speaking device or something like this. But I'm involved in a project here in Switzerland at the moment. It's actually about so we've developed some solutions, community solutions, which work in Luzern. We have a critical mass of people and of services which are available. So that means if I develop a platform for enabling people to communicate, elderly people who say, I have a specific need, and then you say to all of the people in the neighborhood, hey, you can log on there, you can help people and so forth. This has a first initial success, and this is good, but it depends on there being enough people. We're now looking, for instance, at translating that into a village, alpine villages. I think you have the same situation in northern Sweden. I don't think it exists in the Dutch environment. It's much too urban. But here in Switzerland, for instance, we have many villages. You have a problem that the young people leave. They go to the city where there are jobs, where there's a bit more life. The youngest people out there are perhaps 56, and we have that problem which was mentioned earlier, that the people who are available to care for the elderly becomes diminishingly small. And the skills which they require become greater and greater. So we're trying to find actually at the moment a way to address this problem with community apps, with other technologies or something like this. But it's, for me, actually, the first problem starts with where do I get the funding? Because without the funding, I don't even start. Yeah. I think the COVID crisis has also shown us necessity is the mother of invention. When we really need to, we can. but it also involves ignoring other things for the short term. If you're working 24 hours a day and on weekends, you can only do this for a certain amount of time before you collapse. So we can really bring this engagement, this motivation for a short amount of time. I think we also need to find a more long-term solution to the innovation problem. If we identify one problem like COVID and we all attack it, then we can really move mountains. But I think that the problem with the situation that we want to increase the quality of life for the elderly is a multifaceted problem, because this is not just one group of people, the elderly. You have many different groups. They are all individuals. They have different needs, and quite often different health needs as well, more diverse than the actual population. And this is what we need to address. A bit of a long-winded answer, I'm afraid.
Thank you, Andrew. Magnus, do we have any questions from our audience?
Of course we have. What challenges do you see between a decentralized healthcare system and user involvement and the building intelligence? Would a centralized system perform better, or which parts should be centralized versus decentralized to benefit the user and the patient?
Good
question. That is a good question.
This is a really
who likes to answer that? Andrew, you seems to be on.
Yeah, I seem to be on the spot also, because they're asking about building intelligence. I think building intelligence itself, and what we see also in our research is we're moving towards more personalized medicine. This is, I think, supporting the decentralized model. However, also, I'm actually an Australian. I come from West Australia, Perth. This is the most isolated city in the world. And I've spoken to doctors, and they say they love to work in the hospital in Perth because you know that all problems which happen in a radius of 2,000 kilometers come to you. And you see such a huge variation on different problems and so forth that it's a great place to be. You get a lot of variety. And this is what speaks for centralization. So maybe I dodged the question by saying standard things, decentralize. And all of the new stuff which is popping up along the way, we centralize those as much as possible.
Good. Yeah, Henk.
Yeah, it matters about what is centralized and what is decentralized. The physical contact and the neighborhood, etc. That's something that is really decentralized, of course. When you look at technology, for instance, the infrastructure for technology, that would be very helpful if that could be centralized with possibilities for personalization. So I think that it depends very much on what we are talking about. And when it is about funding, for instance, you need to have national frameworks, but you need to also be aware of different needs in the population, and it should be that. So within the national insurance system or a public funding system, whatever you have, there should be enough room for tailoring on local level, because it really makes, as we have said, it makes a difference whether you're in urban areas or in remote areas or in that makes quite a lot of difference. So I think it should, like often, it's and is the solution. There should be some centralization, but there should also be very much local freedom and opportunities for tailoring solutions.
Yes. Any of the Swedes would like to answer that question as well, now when we have the other perspectives on the table? Peter?
I think this is an excellent point that Henk is making. Some things I think now is really the time to centralize a lot of things in Sweden, for instance. We have the IT systems, they don't speak to each other. We have 290 municipalities. We have 21 regions. It's way too many in that respect. I would prefer one single, chart, for instance, so that we can communicate over the borders, or systems in Europe talking much better. If you refer patients between regions, between countries and things like that. But on the other hand, of course, you have to decentralize things locally, I think, is really, really important. We have a different setting in my place in Norrtälje than we have in the northern parts of Sweden and in the Netherlands and things like that. And I think it's really, really important to also emphasize the power that's in every different setting. So I think we need both. Thanks.
So thank you, Peter. I was thinking this perhaps a more overall question to you, Barbro. Being a member of parliament and you meet a lot of colleagues, politicians on various levels. Do you have lots of discussion in the parliament when it comes to innovation and development in elderly care? Of course, there's a lot of focus now on the COVID, but now when it comes to what we have been discussing today.
It depends on what is there a sort of a catastrophe out there, like, you know, this little girl, 3 years old, who died. That causes an immense discussion and involvement and seminars and action. But it seems as if the Standing Committee on the Social Matters, where I am, can't have too many balls in the air at the same time. So now very much work has been concentrated partly on COVID-19, partly on what is happening with children who shouldn't stay with their parents, but in other families taking care of them. I think, therefore, COVID-19 gives us now a chance to discuss matters concerning older people more in detail than we have had for years.
Yeah.
So we have to take this chance, and it's I mean, take this that we should isolate all 70 plus in this country and making equal between a healthy 70-year-old one with someone 95 years old with complex health situation. That was all wrong and meant, and then, I mean, those fighting COVID-19 didn't see that people isolated get other health problems, like what isolation gives, like depression and cardiac problems and so on. But now they have woken up, and I think this is a very important thing now, to catch all these balls in the air about older people and catch them and do something about it.
Thank you so much, and I know that I will work very hard in order to push forward innovation and also new technology, Andrew, in elderly care. And I was always wondering, when my mother was alive, how could I actually help in order to get this iPad or to get this robot or so, but it was very complicated. So we're on our way to wrap up, but I'm going to give you the word, Barbro, very quick.
One thing, this will quality of life for older people. One thing which doesn't need technical things or anything like that is the presence of animals in care of older people, dogs and cats. And where they have dogs and cats, it makes a very, very much difference, because, as you said, from the Netherlands experience, to go out and take care of the animals. If you have a cat or a dog, you feel needed. It's a very good company to increase life quality for older people who are lonely. Thank you.
Thank you, Barbro. So I think it's time to wrap up. Oh, and before I give the word to Peter, Magnus, perhaps you could just summarize the whole workshop in 1 minute.
Thanks. That's always the funniest task to be given, to summarize a couple of good hours in a couple of sentences. But I will try. We're in the middle of a medical, digital, and organizational revolution, which will affect both care and life of everybody. We really need high-tech labs, but also, and I guess even more, we need implementation. We need the implementation close to the patients. The good thing with COVID-19 is the spotlight on the elderly, the positive spotlight. And we are maybe too rich to innovate. That's the saddest thing today, that rich is a bad thing. But we have unequal care, good unequal care, and that is always better than bad equal care. That is my short summary of today, I guess.
Thank you so much, Magnus, and thank you so much to everybody and also to the audience. Peter, this was a fantastic workshop, I think, discussing different angles on innovation. So some final comments from you?
Yeah, thank you very, very much for your input. And as always, with the Netherlands and with the Swiss and with Forum, I think I learn very much every time. And I thank you all for your contribution. Really, really interesting and challenging and a lot of thoughts. I think Magnus summarized it very, very well. And one final from me also thought is that I think the integration, this one positive aspect is, I find in Norrtälje, for instance, that we come from different backgrounds. And I myself, I come from the university hospital side, from the Karolinska University Hospital. This is where I come from. And we have a couple of people coming from the different institutions like that, coming into the elderly home setting, where frankly the sort of the skills in science and doing research and innovation is traditionally, in Sweden at least, not that high. But I can see that the willingness to learn from my people we have 10 elderly homes is really, really big, and they really want to. So we sort of learn from each other. And also, if you come to the personalized medical side, they are much, much better in the care side, also omvårdnad in Sweden, than we are, I think, in hospitals. So we can learn very much by integrating. And I think the holistic, I think all of us have said it in different ways, the holistic side of regarding the elderly and the young kids with complex issues. This is the key, actually, where I think innovation and new technologies and things is really, really, really helpful. We did with iPads in the elderly homes. We had medical, when you deliver medications in all our elderly homes and social care now, we have digital solutions where you can sort of distribute medications, really, really successful. And they are so happy that they have it now for patient safety and things like that. So I think we have to continue this. We have to, Catharina, make another workshop very, very soon, discussing this. And I take up, I think it was Henk who said that we have to also make innovation and funding. This is a really, really interesting topic to discuss next time, maybe, because it's really puts the finger on where the problem or very often is. So I think that's a good topic. So thank you very much for participation, and see you soon.
Yeah. Since we have 3 minutes, I'm going to steal 1 minute at the end, and just to recommend you all our viewers, to actually go in on our website, Forum for Health Policy, where we today publish a report, Innovation in Elderly Care, and we do it in English, and we have different examples of innovations in various countries. So don't miss it. And we also have other reports there. So please, thank you very much. Magnus, something else? No?
No, nothing. More than don't miss the Forum's podcast that is released next week. Maybe the most important thing for next week.
Good.
And in a few days, on Thursday, we will publish a blog article by Andrew Paice, which we will also spread, so which we are looking forward to. And we're looking forward to future cooperation with all of you and all the viewers also to boost innovation and development in elderly care. Thank you so much, everybody.
Thank you. Thank you. Bye-bye.
Thank you.
Thank you so much.